1,592. We mentioned before that that positivity rate went up with the extremely high positivity rate that we have seen in recent weeks due to Omicron. If we look at hospitalizations now, there are 144 people in the hospital at Baptist Memphis with COVID-19 in acute care non-ICU beds. There are 32 patients with COVID-19 in the ICU for a total of 176. That coincidentally breaks the original record during the first large surge of 172, unfortunately. 14 of those 32 people in the ICU are on ventilators. And if we look at Baptist DeSoto, there are 83 people in non-ICU acute care beds, and there are 9 in the ICU for a total of 92, and 4 of those 9 people in the ICU are on ventilators. If we look at the number of fully vaccinated patients in the hospital, at Baptist Memphis, it's 45 of those 176 people who have been fully vaccinated. And of the 25 new admissions over the last 24 hours with COVID, 3 of those 25 were fully vaccinated. And at Baptist DeSoto, there are 7 of the 92 total admitted patients with COVID who have been fully vaccinated. And of the 19 admissions in the last 24 hours, 3 of those have been vaccinated. I expect that what we'll see in part, there's a little bit of a rise in the folks who have been fully vaccinated, who are in the hospital. In part, I think that's largely explained by the fact that indeed, a lot of people in the hospital right now, between a third to a half, if you look at national data, and it's pretty much what we've seen here, are being tested potentially asymptomatically with COVID. And so a lot of those people, in fact, are in the hospital for other things, but they are positive because of screening and the need for isolation in a hospital setting, that sort of thing. That was always sort of an argument that people made, that people said, well, they're not really in the hospital with COVID. And that really wasn't true during the first couple of waves, but certainly it's more true now than it was before with the Omicron variant that appears to be a little bit less severe. So we expect to see that sort of over time as more people are immune to the virus from the vaccine. And of course, in general, once everybody's vaccinated, then everybody in the hospital will be fully vaccinated. And so again, that disease tends to be quite mild, as we've seen in fully vaccinated people, particularly in the boosted population. Again, I've said this many times, but it's worth repeating because people still seem to be confused by this. If you walk through an ICU in most hospitals in the United States now, all of the people in the ICU with COVID essentially are unvaccinated, with the exception of some people who are significantly immunosuppressed, solid organ transplants, those kinds of things, or somebody who's at the extreme of age. Maybe they were vaccinated a long time ago and they have some other medical problems that make them more likely to have severe disease. There are a few of those along the way, but you really don't see vaccinated, boosted people in the ICU anymore. And I just think that's worth repeating as many times as we can say it, because folks who want to suggest that vaccines don't work and none of this is important, that's a very, very important point that people need to remember. So happy to answer any questions if there are any.
Hey, Dr. Threlkeld, it's Corinne. How are you today?
Hi, Corinne. Okay, thanks. How are you?
I'm doing all right. So one question I wanted to ask, looking at the data on the Shelby County Health Department, the date-specific case curve certainly gives the impression that we are coming down the other side of this. I guess, would you agree with how I'm interpreting the data there? Do you think we're through the peak as far as cases? Obviously, it'll be a while before we see hospitalizations go down.
Yeah, no, I hope so. It certainly would be, like what we have seen in other places. I think it's a bit early to say with all the sort of minor irregularities and how things are reported and testing and the like. But I think we hope that this will not last too long. Much more important, I think, to us has always been the hospitalization rate. So the hospitalization rate will probably continue, as you say, for another couple weeks. At least after that. Yeah, I hope it's that trend is coming down. What happens when kids get back in school after the holidays? Those things can be the cause for little bumps in those numbers along the way, much as some of the holiday gatherings themselves have been. So one hopes it will indeed not last much longer, but it's obviously it's too early clearly not to be careful about that because we still have people in the hospital. Some people would suggest that the deaths that we're seeing in the hospitals are still Delta deaths, and that's entirely possible. Rochelle Walensky made that comment, I think, a couple of days ago, maybe, in that people who die of COVID, a lot of times are in the hospital for a long time. We have some pretty impressive mechanisms of keeping people alive with really serious illness. So it is true that some of the people that are dying now in the hospital of COVID have been here for a month or two and might have contracted Delta before. That said, I don't want to leave the impression that we're not still seeing people admitted to the ICU with apparent Omicron. We certainly are seeing that as well, so we don't want to overstate that. But yeah, you hope that we'll start seeing this thing peak. And again, as a lot of people have said many times, me included, I'm optimistic about 2022, but not about the rest of January or maybe even the first part of February for this year.
And could you talk a little bit about this this fourth shot or second booster that is going to become available for people at high risk?
Yeah, so the fourth shot is going to be available, I guess, as early as into the week maybe or into next week for those people who are at highest risk, and that's going to happen simply because of the way things have been adjusted along the way with recommendations. Remembering that those folks who were immunosuppressed were allowed to get a third shot, not then described as a booster, but as just a third shot to complete a 3-dose regimen rather than 2. And that one happened middle of August. And so what would have been 6 months after that, people said, well, we can get a fourth dose. We can get an additional dose or a booster, which what that would have been. But then the booster dose had been backed out to 5 months from 6 months. So as the calendar plays out, those who got a third shot in August would then be available for a booster, in their case, a fourth shot, unlike people with normal immune systems. And that will be playing out in the middle of January. So within the next few days, people who got their shots right away as a third shot would be eligible for that fourth shot. The fourth shot obviously remains a bit controversial. There's nothing that's been any more controversial in terms of just interpreting the data than booster shots along the way. We saw Israel sort of took the lead on that. And if we looked at their data for boosters, they really cut down on the cases of symptomatic infection by getting a booster. That is particularly true with Omicron. So what was originally a bit controversial became much less so with Omicron. Before Omicron, people were still being protected quite nicely from severe disease and death by just the 2 RNA shots. That is still the case in all likelihood. But you started to see a lot more breakthroughs, particularly with Omicron. And if you look at the Israeli data over significant periods of time or months, you actually might see a little bit of a boost in more serious disease as that immunity waned significantly in the elderly population. So now, just recently, Israel had taken the tack of folks over 65 that are more likely to be involved in more serious disease could get a fourth dose. So a fourth dose per se is still kind of under advisement being examined by the CDC here. They're talking to the officials in Israel and watching those data carefully to see if those curves diverge at all between those who are getting that fourth shot and those who do not. It's obviously an irritation for people to talk about getting a shot every 6 months. Certainly, we're used to that with the flu, getting it every year. But time will tell whether that's going to be true or not, whether a fourth shot for us. Remembering, again, that the people that we're talking about in your question, it's really a booster of what was kind of just a third shot for immunosuppressed folks. So the fourth shot would be about the same as the third shot for you and me if we have a normal immune system, because we didn't need that third shot in the first place. Any other questions? I'll deal with a couple of questions from the feed. Annie Billions asked a very good question, and that was the concern that the rapid tests are not working against Omicron, and they are particularly insensitive. That is to say, you would miss a lot of cases of that. It is, I think, on the surface true that Omicron has proven to be a little better at not showing a positive test, and it's not totally clear why that's the case. But Omicron probably shows a little decreased sensitivity, remembering that the antigen tests the at-home antigen tests that look for pieces of protein of the virus, not for RNA or nucleic acid material, those other tests are more sensitive. The antigen tests have always been less sensitive, but fairly effective, particularly at picking up people who had high viral loads, high protein production, and were the most contagious. So I think there are a couple of things that are about that. Most of the data that we have seen when you really looked at and studied, like the Abbott test, the Quidel test, there did not appear to be any big decrease in the susceptibility or the sensitivity regarding Omicron. It still picked up a fairly good percentage of those, though not as much as the nucleic acid tests do. There doesn't appear to be any very, very large decrease because of Omicron, but there are a couple things to think about. Number one, a lot of the people who are bothering to get the rapid tests have also already been vaccinated. One person who tends to be more diligent about one also is more diligent about the other. And so you may be dealing with people who have lower viral loads to begin with. And so they would be less likely to trigger that antigen test that would require a bit more virus to be produced and therefore be more contagious. We know that folks who have been boosted particularly put out less of that viral load. And so that's part of the reason why a lot of people will test negative the first time, and then you test again in 2 or 3 days, and they will turn positive as that virus ramps up a little bit. But it's always been the case, always through this infection, that people sometimes just don't have a positive test. I certainly have several cases, including an associate of mine, who received 3 RNA tests, 3 PCR tests that were swabbed correctly, and all of them were negative. Then on a more sophisticated testing a short time thereafter, clearly had a positive case. So testing has never been perfect, but I think people who are boosted are going to show less virus, and that's going to be more likely to show a falsely negative, if you will, antigen test, though it's only negative because they're putting out less virus. I've mentioned on a couple of occasions that the people that I've seen where members of a family, say one spouse has the infection, it's very, very much the case that if you have a situation where one spouse gets it and the other one doesn't, that is far more common in a pair that have both been boosted. You're putting out less virus on the infected person, and there's a better wall of protection in the people who might be exposed. So it certainly is the case. I think that may be one of the factors in why we see a little bit more in the way of negative tests for antigens despite disease. If you were exposed to someone in your family with COVID-19, you've had clear exposures, and you have a compatible illness with a respiratory infection, and you have a negative antigen test, please back that up actually with a PCR test in a day or two, or at least repeat the antigen test in 2, 3, 4 days to try to make sure. Don't go out among people and infect them, and particularly in people who might be at higher risk, because we see a lot of that, unfortunately. The 2 errors are that people say, well, it's negative and it's a cold and I'm not going to worry about it. If you really are at high risk from exposures, it probably is COVID, at least right now, for the next 2 or 3 weeks until this surge really plays out. And the other that we've said many times, but again, bears repeating because it actually confuses a lot of physicians even, if you get a positive rapid test, it is really positive. It is possible to get a false positive, but they are exceedingly rare. So do not go and wait and get a PCR to back up or verify a positive antigen test. Only do that for a negative antigen test. And I remember seeing a comment in the feed one time that said, well, saying that was a ridiculous way to look at it, but it just is a matter of the difference between sensitivity and specificity. Some tests are easy to find the things. They really are good at finding it, but they cause some false positive. Other types of tests are really reliable when they are positive, but they're not as good at seeking them out. And this is true of every test that we do in healthcare. It's why one test is selected over another one, whether it's an HIV test or a syphilis test or other types of blood tests or certainly these antigen tests as we go. So, any other questions? Sarah points out, I'm fully vaccinated and I am at home positive for COVID. Then Sybil actually points out correctly afterward, yes, but you are most likely not sick enough to be hospitalized because you were vaccinated. And again, the idea that you can still get sick when you've had COVID vaccine is not a surprise. The fact that you're not sicker and hospitalized is the advantage of the vaccine. And again, to just repeat a point that we've said many times, it does in fact cut down by 70 to 75% of those people who would get symptomatic disease. So if you've been boosted, that cuts down your likelihood of having symptomatic disease by 70 to 75%. It only cuts it down by 30 or so with Omicron if you are only vaccinated without the boost. So it does, in fact, cut down on symptomatic disease. And again, what you don't have, you can't pass on to others. So there's certainly advantages of being boosted along the way. And it does, in fact, prevent you from getting sick. It just doesn't obviously do that perfectly. Suzanne Calvi asks, why do they keep changing how long you should quarantine? We've kind of talked about that before, but obviously you want to quarantine people while they are most likely to be infected. That if you test along the way, I think is the best way to make sure that you're not positive to then wear that mask for the rest of the 10 days. And again, we've seen the CDC guidelines change in that if you are fully vaccinated and boosted, or if you've been recently fully vaccinated, that you don't need to quarantine in that sense at home. So it does mean that the kind of definition of fully vaccinated is not the definition of fully vaccinated really is coming to include a boost, in that some of those recommendations diverge. Suzanne mentions a lot of false positives. I would sharply disagree with that. Again, as I mentioned before, you can have a false positive, but it is so uncommon as really not to be likely to occur at all. And so many people have been harmed and have really passed on infection because they assumed something was a false positive because they weren't terribly symptomatic. We know that that is not a good idea. Bonnie asked, is Shelby County using wastewater surveillance to predict stages earlier in the timeline? Good question. I'm not aware that they're doing that to predict that. You have seen that occur in that it can be released from the intestinal contents, COVID virus. And so people who did testing on wastewater and sewage did, in fact, see a big uptick in those positive tests from that wastewater before an actual outbreak of clinical illness occurred in the community. And we've seen that in a number of tests. I apologize if we are doing that. I'm not aware that we're doing that significantly in Shelby County. It is, of course, already here. So in terms of the Omicron outbreak, we're sort of behind that point anyway. And here again is another sort of thing that Randy says, I know over 20 positives and all but one are vaccinated. So once again, that kind of misses the point. If you know 20 people who are positive, I know 120 people very easily right now, 176 in fact, that I can point to you. And sure, some of them are vaccinated too, but they aren't hospitalized because of that. So it's exactly, I mean, it's not proper logic to say, I know plenty of people are positive, and most are vaccinated, because it really, the larger number is in the people who are unvaccinated, and certainly the vastly larger number is those who are really sick. Those people are not vaccinated, and they certainly aren't boosted. I think people sort of double down on this, and I'm just forced to kind of mention it. Are you telling everybody that most are vaccinated? Sorry, are you telling everybody that most are vaccinated that are getting this? And that was kind of a follow-up to the first point. I'm not telling that to anyone because it's not true. I even had someone in the feed say that their spouse worked at a hospital, and they were suggesting that most of the people who were hospitalized and really ill were the vaccinated people, not the unvaccinated people. Here on Earth, that is not true. No hospital in the United States has seen that, and that is absolutely not the case. And we certainly want to make that clear to people. Bob mentioned the common cold and the flu have hundreds of variants also. For some reason, we don't freak out about that. It is true that there are many, many viruses that cause the common cold. They don't necessarily have hundreds of variants in each one of those. Remember, there are 4 coronaviruses already out there. They are not varying a great deal in their genetic material. The flu certainly varies from year to year. And in that sense, we have to take a vaccine every year. And it does bring up the point that at some point, we're going to have to decide as a society, how we deal with this and how much we shut things down, because the flu kills, I think, 30,000 or so people per year in the United States, and we don't get too excited about that collectively as a population. And so, we'll have to decide that, but not during this wave of Omicron. There are too many people who are getting sick, too many people hospitalized, and indeed still too many people dying so far. But after the Omicron wave is over, yeah, we'll have to sit down and think about what we're able to tolerate as a society. One of my old bosses, I think was at USA Today, quoted the fact that we need to maximize protection and minimize disruption. And both of those are great, but they don't always play well together. And so we have to get to a happy medium about some of those things to decide exactly what we need to do to protect people. And finally, my favorite of last week from Donna, you can see the stress in the doctor's face. They get scared when you try to get the truth out of them. Sorry, Donna, this is just my face. I'll try to do better next week, but I'm not particularly stressed about that. So, but thanks for that. Any other questions I can answer? Okay, have a great day. Thanks.